Hello, welcome to my channel. So you're thinking about pursuing genetic testing for health purposes, and you're wondering where you should send your test and how it should be done. So to answer those questions, we need to consider two main factors. The number one is reason. What's the reason you want to go take a genetic test? And number two is who. Who do you plan to show your results to? So let's think about reason first. If your reason is that you don't have a specific reason, there is not a specific disease that you are worried about, but rather you just want to stay up to date about your genome and how your health is impacted by your genetics. In these cases, a lot of people would go to direct-to-consumer genetic testing companies to get tested, or some individuals might even go through a clinical genetic lab to get tested. And because there's not a specific disease to worry about, you might choose a test that has the name comprehensive in it. Although the word comprehensive is not really regulated, there really is not an effective way for it to be regulated also. Or you might go to whole exome testing. This is the test that covers 1% of our genome, and that's also the 1% that we know most about. Or you might even go for whole genome testing. This is the test that, by definition, it means it tests every single nucleotide of your genome. It covers the whole exome that we just talked about and the other of the genome. So exome is 1%, the other is of the genome is 99%. So it's good to cover all of those areas, but you want to, in reality, a lot of those areas, we don't really know much about it. And when we say every single nucleotide, what it really means is every single nucleotide of the human genome that we know of and that our assay can access. And the latest high-profile paper published about human genome says that the scientist has the most completed human genome so far, and that's published in 2022. So that's fairly recent. That's just an example to tell us that our knowledge about our genome, our gene, the causal mutations of the diseases is advancing all the time. So regardless of which test you go to, even if you go with the best test, the most complete coverage of tests at the time, the results that you're getting is never a done deal. To stay up to date about your genome, about your genomics, you really need to do these once per a few years as our knowledge advances. And maybe 5 years, in my opinion. And when I say to redo the test, I'm not talking about taking your old sequencing data to redo the analysis. What I'm saying is drawing a fresh sample, extract the DNA using the best method that you know of, and the newest test and the newest analysis. So that's for the first reason, if you just want to be up to date and there's nothing specific that you're worried about. So the second reason, it might be that you are actually worried about a disease. For example, maybe you recently have a family member who is diagnosed with cancer, or maybe your sibling just had a child with a genetic condition. So now you question whether you have this pathogenic mutation. In these cases, you should go get tested in a clinical genetic testing lab and go get genetic counseling as well. So as far as how the test should be done, that really varies depending on which disease we're testing. At this point, because of the situation you're in, the stake is very high. So you really want to go for a test that gives you the best chance to make a diagnosis. And in that, there's a lot of art in there. And if you check my previous video, for example, in hide and seek in genetic testing, I talked about just by using different methods of sample collection can impact our ability to detect mutation. And in the episode where I talked about Duchenne muscular dystrophy, I talked about how some assays are very good at detecting large event, the large deletion or duplication in our genome, and some assays are good at looking at really fine events such as small nucleotide changes in our genome. So in those situations, go to a clinical lab get counseled by a genetic counselor, go seek medical advice from a clinical geneticist to pursue the best testing that you should take. So those are the two reasons that you need to consider, and then depend on that, you will know where and how to do the test. The second one to consider is who. So who is going to look at your results? If you plan to show your results to a medical care professional to seek medical advice down the road, then you really should start the process by having a conversation with your genetic counselor or with clinical geneticist before you dive into the testing. You need to make sure that these professionals, they acknowledge the company, the testing lab that you are going to pursue test with, and that they are allowed to make medical advice based on the test results that you are about to get. Of course, most of the times life doesn't happen in perfect order. A lot of people may just get a test results. They weren't thinking, they might just pursue a random test through a direct-to-consumer company, and they get a results that's worrisome. That happens in these situations. Still, go to your genetic counselor. Be prepared that most likely you will be asked to take a new sample and send the sample to a clinical genetic testing company to repeat the testing, just to confirm and before the medical professional can give you advice. So that's it for today. Hope it helps. Thank you for stopping by. I'll see you next time.